Hey, what's up, everybody? This is LoveReigns, and I'm back for a special edition of the Random Thoughts of Rain podcast. Once again, my name is Taryn LoveReigns, and we are here, man, and I'm excited. So, shouts out to the MPN network, and we're here to talk about a super cool and special event that's happening this Saturday here in Jacksonville. And so, I'm here to speak with some of the creators of the event. So that we can learn more about the COVID vaccinations. We're going to get real, right? We're really going to get real talking about this vaccination. Should I get it? Should I not get it? All these good things, all these things. So I have the pleasure today of speaking to the wonderful folks at VAX 904. This is an event that's happening this Saturday at the Master's Touch Ministries, which is located at 4510 Soutel Drive. And it's from 9 a.m. to 5 p.m. And again, it's called VAX 904. There will be vendors and health screenings available on site and live broadcast from 93.3 The Beat, 101.5, and Praise 107.9 radio stations. It's all about talking about the COVID vaccine. And today I have the pleasure of speaking with two amazing gentlemen who are part of the VAX 904 team. First up, we have Dr. Bruce James II. He is the founder of Healthcare Equity Solutions from Bainbridge, Georgia. He is a proud alumnus of two HBCUs, Tuskegee University, where he received a Bachelor of Science degree in chemistry, and Florida A&M University, where he received his Doctor of Pharmacy degree. He has been a leader in various organizations at the state and national levels. So welcome, should I say Dr. Bruce or Dr. James?
Dr. James, Dr. James, good afternoon. How are you? Look, happy to be here with you. Happy for you to have us here.
Yes, sir. Yes, sir. I'm happy to have you here too. Can I call you Dr. Bruce? I don't know why. I think about Superman.
Well, yeah, if that works for you, yeah, that's absolutely fine. No problem at all.
I just feel like the whole, like you could really play off the whole Superman thing with a name like Bruce, and being a doctor, I'm just saying.
whatever you feel most comfortable with. I'm
All right, cool. We also have Mr. Mikhail Scott. Mikhail is a director at Indelible Solutions. He specializes in government, nonprofit, and corporate relations, and has supported the development, analysis, and approval of state and local policy covering multiple issues, including food security, affordable housing, transportation, and economic development. Mikhail has worked with both. Oh, I'm sorry, I read that already. So Mikhail is the project manager for VAX 904. So welcome, Mikhail. How are you?
Thank you so much, LoveReigns, for having us on. We're really excited today to deliver this message and do it in a way that people are going to relate to it and can take something from to share with their families.
Yeah, for sure. Well, thank you both again for chatting with me today. So let's just get right to it. VAX 904. What is it, first of all, and why should the people of Jacksonville come out this Saturday?
Absolutely. So I'll jump out and take that. And again, my name is Mikhail Scott. I'm the project manager for VAX 904. And essentially what it is, it's a community partnership that was spearheaded by our firm, Indelible Solutions, along with the Florida Department of Health and the Division of Emergency Management. And the focus of it was to provide more awareness, educational opportunities, as well as access to the COVID-19 vaccine, specifically in communities of color and underserved communities here in Duval County. And so we've been able to do a lot of outreach and reaching into these communities that typically don't get access to healthcare equity. A lot of folks that are typically left behind when it comes to, rolling out of vaccines or even rolling out of any type of service. And so what we're really here to do is make sure the message gets to the people, our people that need it the most, in a way that they can relate to.
Yeah, for sure. Well, I definitely appreciate you both for doing that and being a part of that and bringing it here. So why Jacksonville? What made you choose Jacksonville?
So honestly, the way this all started, we created the idea of educate, vaccinate. Our firm, along with a few other minority business entities, Indelible Solutions is a minority business firm. So our founder and CEO, CFO are all African American. One of the founders is actually from here in Jacksonville as well, where we have our headquarters. So we created Educate, Vaccinate, and it actually started in the state of Virginia. And so we were up there working with the Virginia Department of Emergency Management, because in our line of work, we work with disaster recovery, emergency management across the United States. And so we got a call from the Division of Emergency Management because they heard about what we were doing in our efforts to make sure that underserved communities and communities of color were getting access to the vaccine, but we're also getting the awareness that they needed to combat hesitancy. And so we were called here essentially for a 30-day initiative to really hit the ground and share a lot of information with folks through events, high traffic areas, and working with community partners, churches, and a lot of other folks that have helped support this movement.
Yeah. Awesome. So Dr. James, I'm sure that you get put through the ringer. I'm pretty sure. So, in terms of talking about the hesitancy, right? I'm sure you face that a lot. Like, how do you combat that when you're talking about the importance of the vaccine especially to people of color?
So one of the biggest ways that I would say that I utilize to combat hesitancy is to stick to the facts. The hesitancy is real. I mean, it's healthy hesitancy out there. There's things that, precede us here in America that don't really speak towards the protection of the African-American community as it relates to health. So the hesitancy that's there, it's definitely healthy, and it's definitely legitimate. But one way that we at VAX 904 look to combat that is really, really sticking to the facts and sticking to what we know. And the science is real. So with any hesitancy, we try to combat it with a clear cut fact that is real, and that hopefully once someone talks with us, once someone presents their question to us, we can send them off better informed, better equipped to make a better decision for themselves.
Right, for sure. I agree. And I'll be completely honest. And we were talking earlier, I was one of those people that was really, really hesitant, about it. And really not hesitant because I didn't believe the numbers were real. It was just the fact of just being unsure, you know what I mean? And reading stuff on Facebook and hearing all the reports and, hearing people say, oh, they're going to put chips in the vaccine and then they're going to be able to track us just feeding into all of the craziness. Right. But one of the things that really changed my mind was I removed myself from the equation. I wanted to do it to not only keep myself safe, but I wanted to keep my family safe. I wanted to see my mom. I didn't go see my mom. And it was like, I think the last time I saw my mom prior to going to see her recently was like January of 19. And that was a long time, and it was just like, I'm sorry, December of 19. And I wanted to see my mom, and I wanted to make sure that, I stayed safe, and because I just wasn't sure, right? She's susceptible and I'm not, but she's more susceptible than I am, right? Because of her age. So I just wanted to make sure that I protected myself so I could just see her, right? So one of the main driving factors for me was taking the vaccine, getting vaccinated, not only for myself, but for my mom and for other people, because I am out in the public, I am doing things, and I'm still wearing a mask, even being vaccinated, right? I'd rather be safe and be called crazy than not,
You make a great point, right? And so with the outreach efforts that we've been doing, we actually have specialists that are going with, fact-based literature that we've gotten corroborated with the Florida Department of Health. All the information that we're providing is, the truth, the facts, and we're going door to door. We're out in community events, right? We're going to events and tabling and allowing people to come up and talk to us and really ask those real questions that they have, right? For folks that are still nervous or need more information. But I think you made a really good point, right? And this is one of the taglines that we use as well. It's like, it's not about you, right? Or, it's not about me necessarily, because in the African-American community, we have to understand from a public health perspective, we are more prone to have chronic disease, right? We're more prone to have certain issues or health issues that are going to put us at a higher rate of getting it or higher impact or disadvantage. And so when you think about yourself as an individual, how many people of us know folks in our family that have diabetes or have high cholesterol or might have some type of breathing condition or just might be elderly, right? So now you're thinking about, you want to spend time with these folks during, July, 4th of July and Memorial Day, with that coming up, in the summer's here, right? We're here in Florida. Everybody's ready to get back and have the barbecues. But if you're not vaccinated, you're putting all of those people in your family at risk.
Right.
And it's all fun and games until there's a situation where real true situations that we've even had folks tell us on the ground, stories where folks have come back home younger, around their older parents, get them sick, and it's a detrimental situation for that person, right? You lose your mother, or you lose your grandfather, or you lose, like, those are true stories, and it's sad, and we don't really like to talk about that, but that is the reality for our community. And with us being at a higher risk and also taking the vaccine at a much lower rate, it only exacerbates the problem.
Yeah, I agree. I mean, and I get it. You know what I mean? We don't, somebody, I was watching Saturday Night Live, and they were doing, a skit, and they were like, well, why are you so hesitant? And I can't remember the actress's name, but she was like, Tuskegee, the Tuskegee experiment, so it's not like we have the best history when it comes to the United States and Black folks, right? So what do you say to that? Like, aside from the facts, like, when you get real, especially with like family and friends, how do you get real with them and address the fact that, look, I realize that they ain't never cared about us, right?
Right.
That's what Drake said. They never cared about. They never loved us, right? We know that, but we also have to understand that it's beyond us. So how do you talk to, when you're getting real with your friends and family, Dr. James? How do you talk to them?
So the first thing I like to pull out from all of that is, let's first understand, just the pandemic itself. Pandemic means this virus has touched each continent that's housed within Earth. Like, it's not a continent that didn't experience COVID-19. First time ever something like that has happened. And because of that, you can understand, and you can probably relate, like, no one's targeting just a select group of people. And we can see that through that, if you take a step back and get outside of America right now, and we look over at India, or we look over at Venezuela, these are countries whose governments have literally said, hey, it's nothing we can do. We don't have vaccines here. It's nothing we can do to save you from the harsh consequences of this virus. So really, for us, and we talk about this a lot, like, it's actually fortunate that this vaccine is being provided to us, and it's being provided for free. Now, we can't say that this will always be the circumstance. At some point, the federal dollars are going to dry up. At some point, this won't be something that will be afforded to us and just handed to us for free. And that time is coming sooner than later. But once that happens, what communities or what group of people will be left in harm's way the most? It's going to be us. So that's why we're taking initiative, and we're trying to do everything that we can. We don't want anyone to get vaccinated solely because we got vaccinated. Right. It's our goal to arm each and every one that we come in contact with the proper education, so that they're educated and they can make the most informed decision about whether they should get vaccinated or not.
Right. I agree. And I'm actually glad that you brought up that point, because that's one of the reasons why, it's something that I've battled with, kind of being like a public figure. I wanted to speak out and talk about being vaccinated. I see people, posting their cards and, showing their arms with the Band-Aid and all that stuff. And it was a personal thing for me, right? And it wasn't necessarily something that I wanted to just, share with the world. It was I just did it for me. I did it for my mom, right? I did it for my family. I did it because I want to be around the people that I love, right? So it wasn't something that I, necessarily wanted to broadcast, but I just wanted to kind of lead by example and showing people. You also mentioned too, when we talk about privilege, I think that we sometimes forget that living, although, the US has its problems, it has many a problem. However, we also are very privileged in a lot of ways, right? And having the access to the vaccine is one of those things that we tend to forget and we tend to take for granted. That, you know, if you think about, I think it was I don't know if it was China or Korea, where they were like beating people for not wearing masks, hitting them over the back with sticks, and
Yeah,
we laugh and joke about it, but that's a real thing.
very
Right.
serious, very
And
serious.
we actually forget that we are still very privileged, right? Like, you know, I'm not letting the U.S. off the hook in any way, but I'm just saying in certain things we are still very privileged. Now, Mikhail, when you were talking about or when you were thinking about, you know, doing the project management side of the VAX 904, what was it? What were some of the things that you were thinking about? Because I'm sure it was hard to write, you know, to overcome the hesitation and overcome and think about all of the people that probably would say, you know, oh no, or the naysayers, right? So when you were thinking about putting the project together, the VAX 904, what were some of the things that you wanted to include to make sure that people come out?
So I think one of the most important things in our team, you know, we really brainstormed about this to figure out, you know, from our position as a minority firm, what is it that we bring to this conversation and what understanding do we bring to this whole narrative that, you know, other companies might not understand or other governmental organizations might not understand. And that's the fact that we understand our communities and how they run. So when we thought, how can we be most impactful? We knew that it couldn't be us going into a community and trying to do this alone. We had to make sure we built community partnerships, right? So the focus was always to connect with local faith-based organizations, connect with the local churches, the local nonprofit groups, those community influencers and leaders that are recognized as someone who has truthful information, right? Someone that can be trusted, someone that can be you know, a resource when you're looking to try to make bigger decisions. And so that's really what we did. And I know you mentioned our event that's taking place this Saturday, May 8th at Master's Touch Ministry. That whole event incepted by me being connected with a local church pantry coalition that literally has been working in these communities, working in their church congregations, providing food multiple times a week to people during the pandemic. These same African-American families, these same Black communities that were put out of work during the pandemic, right? Mm-hmm. That were able to go to work or were sick or might have any other level of circumstances that put them in a position to not be able to have food. They've been on the front lines, right? So they know where the biggest impact and where the biggest need lies. They know the people that need to hear this information the most. And so partnering with folks like that, we're able to gain that trust of the nephew that doesn't want to hear me, but will listen to his grandmother, right? Or that might listen to his aunt. And then also those other community organizations that have a following, that if someone like, for example, you, right, you were kind of hesitant, and even myself, about being very vocal in broadcasting, getting vaccinated, even though I knew how important it was, but it is important for us to stand up for that and not if we understand the facts. You know, the public health reality is, Dr. James is correct. These resources won't be available. The AP released and I say the AP, the Associated Press released an article today that said the Biden administration is going to be reallocating vaccines from states that are not utilizing them or that have low turnout numbers to places that need them more. So what that looks like is here in Florida, where all of a sudden these vaccination pop-up clinics stop happening, and then summer comes and flu spike, and then now you're looking to try to find the vaccine, and it's nowhere to be found because it's in another state or it's been shipped to another country, because that's the reality too, right? There's a lot of levels that play. And so we're very privileged. And a lot of times the Black community doesn't have first access. You know, we get left behind. We get the secondary, right? During segregation, we get the less than. But at this point, we're getting the same thing that our white counterparts, that our Asian counterparts, that, you know, the wealthy folks that are running to get the vaccine, by the way, you can see it on the news, right? They're running to get it. They were trying to get it. They're probably been paying to get it. So we have to be more mindful and really do our own research to get to the bottom of what's happening. And that's what we're here to do, right? Give you accurate research from trusted sources that you can do.
Yeah. So how does it feel coming to a state like Florida?
Right.
Knowing that, you know, because I look at the numbers, I mean, just here in Jacksonville, we just did, you know, there was a sold out concert at Daly's Place last week. And, you know, people are still just walking around like there's not a whole pandemic out here. So
Right.
how do when you approach situations like that, like how does that make you feel? Like do you ever find yourself getting frustrated? Because we're talking about going on 2 years now, right? So do you ever find yourself getting frustrated when it comes to the whole thing?
Yeah. So I would say it's more so when we started this type of work, we kind of knew what we were getting into. And we kind of say now, well, we've worked ourselves, and then this is a plus. We worked ourselves into a place to everybody who wanted the vaccine, everybody who wanted to be vaccinated, they've been vaccinated. So now we're at a really, really cool intersection and a pinnacle to whereas we're really having to impact minds and actually change mindsets around the vaccine itself. So we understand that task is going to be a little harder, and we understand that it takes a little longer. But I don't think it's something more so that frustrates us. It makes us strategize a little more and figure out strategic ways to become more receptive, to be received better by these communities. Because at the end of the day, these communities, the people in them look like us. These are our people at the end of the day. So we've kind of taken on as a challenge, as it's up to us to strategically figure out what way can we best reach our people, reach our communities, and offer this information that is so pertinent to our future.
For sure. And you mentioned the concert, right? You say,
Yeah.
does it frustrate us? We're putting ourselves truly at the front line. So we're making sure that, hey, where can we go and actually reach people, or at least be seen by folks that are in that younger generation or younger demographic to relay the message. So we're going there, we're meeting them there, right? So we're actually tabling at vendor sites at some of these community events where people are coming out for concerts, right? The River Art Walk, we're at places like that. The River Jams concerts, we were there with our masks on, right? That we've been vaccinated, with our information, talking to people, having those conversations, and getting into some of those spots where maybe someone normally wouldn't go, but we know that's where you can reach them. And if they see us, and they see us collectively, and they see us often enough from those respective sources as well, you start to make movement with people. And we understand we can't convince everybody, right? I think Dr. James and I talk about this quite a bit. Sometimes it can be like, you're what is it, beating a dead horse. Right. But that's not always true, because if it's a conversation with 5 people and one person walks away and says, you know what, maybe I should go handle this so I can go spend time with my family and not have to worry about anything, that makes a difference.
That's a win.
That's a win.
Yeah, I agree. I mean, and you brought up a valid point. I mean, if we think about everything, even when it comes to, religion and voting, voting rights and getting people out there to vote, we have to lead by example. You know what I mean? We definitely have to lead by example when it comes to getting it out there and talking to people. So I think that is extremely important. And I think also too, what's really important is that people need to understand it's not about you, right? I've had my own personal feelings about the whole thing and about the vaccination, and I've had, but I never vocalized it, because I wanted to make sure that I educated myself first before I said anything, right? So I wanted to make sure that people understand, like, look, it's not about you, right? It's not just about you. We are all here together. And if it means us wearing a mask, because I'm still gonna wear my mask. I don't care where I am. I'm still gonna wear my mask, vaccinated or not.
Right.
I just had my second shot on Sunday. I'm still wearing my mask, because the thing about it is, it's not just me. It ain't about me. You know what I mean? Like it's more than me. It's about my family. It's about my friends who are, immune compromised, right? So can you talk a little bit to that in terms of, getting people to understand, like, just if you just step outside of yourself for just for a second.
Yeah, definitely. And Mikhail he hit on it a little bit earlier when he spoke to just African Americans and the African American community being the ones that suffer from these comorbidities more so than any of our counterparts that are housed right here in America. So when you think about it in terms of that, and then when you think about hey, so COVID-19, what is it really doing? When you get the virus, it's having a lingering, lasting effect on these same major organ systems that our community is already plagued with disease. So that's just a perfect storm for bad things, a bad trajectory for us health-wise here in America. So that alone should be enough to have us, we're what we call the high priority group. If you have auntie or grandma or mom or dad who has hypertension, who suffers from hyperlipidemia, who has high cholesterol, well, those people are more susceptible, and those people will have, it's proven, badder experiences if they get COVID. So we want to try and combat that as much as possible, because ultimately that'll help our survival rates for the virus itself. So when we think about people with comorbidities, and we think about us and the African American community, we all should be trying to push or trying to help someone else, because we all know somebody that suffers from these comorbidities that plague us.
Yeah, for sure. So as far as and then the other thing I wanted to touch on too, as far as beating the dead horse, I feel like that was something that was a lesson I learned during the election year. Is you can't beat a dead horse, no matter how you feel. Right? You feel passionate about it. You feel passionate about the people. But at the end of the day, people have the right to choose what they, whether they get it or not. Right. Absolutely. So whether they choose to get the vaccine, hey, I can't knock it. Right. So I think the other side of that is that we also have to understand that we got to give each other grace. Right. Because at the end of the day, there's just people who are not going to do it. And that's okay. That's, that's on them. Right. But I know for me, what is it? What's the like how people have in their house? As for me and my house, as for me and my house, in my little 1-bedroom, we gonna get vaccinated. Right. That's what it is, and we still gonna stay around. Stay from around crowds of people. Even the event, like it took a lot of convincing for me to even do an event last Friday. And even with that, we made sure that people wore masks, like the masks were mandatory. It was limited capacity. Mikhail, did you want to say something? I'm sorry.
Well, no. So you did touch on something that I think is very important, right? We're not trying to force anybody. We're not peer pressuring anybody. And so that's another cool thing about our event that we're doing this upcoming Saturday. We're not just focused on drilling people to get vaccinated, although we want you to understand the truth and the facts and decide whether or not it's best for you. At our event, we're also going to have health screenings so people can get their blood pressure checked. They can come and get their blood sugar checked, right? They can get access to some of the vendors that we're going to have there that'll be providing health information about local resources for seniors and local resources for folks that might not have access to health insurance, right? So it's more about the broader picture of public health and how do we as a Black community not necessarily, be swayed to get vaccinated, but understand that we have to take control of our own health. We have to be more aware of it, and we have to get out of that shell of, not going to get checked out and not, putting off some of our health related stuff. So I agree, we don't want to convince anybody, but we want you informed. So whether you come that day, you get some information and leave with your mom, or if you come that day and you decide, hey, today is the day for me to take control of this and to get it out of the way with so I can be protected, it's up to you, right? But we'll have everything to learn, to get vaccinated and to walk away, we didn't have before you came.
Yeah, for sure. Somebody said, so we got laugh out loud. Grace is important. Also, being able to agree to disagree is crucial as well. I agree, completely. We gotta, and that's with everything, not just with COVID or, let people be, right? It's okay to have healthy discourse or healthy conversation without, getting mad or beating each other up. Just agree to disagree and move on. You know what I mean? That's it. So it's important for us to do that. So now, are either one of you into like hip hop or like poetry?
So we definitely both into hip hop.
I feel like a little birdie told me.
Right? Really?
Okay, so here we go. I'm about to put you on the spot.
We got to put us
on the spot.
I'm about to put you on the spot. You got. All right, bust a freestyle on why people should come out this Saturday.
Okay. Do we have music?
You gonna give us an instrumental? Okay.
I can't do no. That's no.
This
Pete, we're gonna have to see if Pete. Pete, can you come on and do some beatboxing? I am not good. I stay in my lane. That is not my lane.
Oh, that's crazy. Can you want to give me a beat?
I'll give you a beat.
There you go.
Okay. Okay, I'm up in Duval and I'm talking to my people, trying to tell them help as well. I'm up in Duval County telling everybody, come on May 18th, get your health check. Hey, the vaccine is on the scene. We trying to educate our people. What I mean? Okay, my dog Dr. James got my beat. I just got my feet wet. That's all I got.
That was candid. Now we didn't practice that. Like,
that was dope.
Intermission. We would have. Nah, I'm just messing.
No, that was actually dope. Dr. James got my beat. I just got my beat. I like that. I like that.
Yeah, man, this is my guy right here. Like, seriously though, Dr. James and I have really been brainstorming. You know, him coming from Tuskegee and having that kind of is the cloud over this vaccination process, right? We know that people have been disenfranchised. We know that African Americans a lot of times don't get the health care that they deserve. We're forgotten, but you know, we're not saying this is the end all be all that's going to save our people, right? No, we still have to do action. We have to take action. We have to be more informed. We need more people prioritizing their health and looking into that. And so we hope that this will really just spark that awareness for folks to understand that, you know, it's okay to look into that, right? It's okay to go get checked out. Don't put that thought to the side. You know, come find some people that look like you, right? We've got a Black doctor. We've got other Black medical experts that are going to be at our event, that are going to be talking to folks, answering any questions you might have. And like I said before, you know, come out and get some great information and, you know, leave more settled, or even if you don't change your mind, maybe you can deliver that message to someone else who might.
Yeah, for sure. So informed consent is it get the correct information and make the decision that is best for you.
Yeah. Sure. And I would say, in addition to that, don't let an unanswered question be the reason you don't get vaccinated.
Right.
I would say come and ask that question and let the answer be the reason you say, oh no, yeah, that's not for me. Don't let the question linger and that be the reason you say, well, you know, I don't think I'm gonna get the vaccine because I don't know this or I don't know that. No, seek the answer to that question and then make that informed decision.
Yeah.
Yeah. I like that. Well, thank you both so much. First of all, for entertaining me and doing that freestyle. That was dope.
Hey,
that was fire.
We can't be at the doors, knocking on people's doors and not be on our toes, right?
Right.
Just in case, right?
You're right. Yeah. You're right about that. Well, I appreciate you both. So once again, y'all make sure y'all go out this Saturday, May 8th at the Master's Touch Ministries, located at 4510 Soutel Drive, from 9 a.m. to 5 p.m. Again, there'll be vendors, health screenings, on-site live broadcast from 93.3 to Beat, 101.5, Praise 107.9. So make sure y'all come out, even if it's not to get the vaccine, just come out and get educated, come out, get informed, and come out and meet these two amazing gentlemen. So thank you, gentlemen, for everything that you do. Thank you for coming to Duval and for sacrificing and sacrificing yourself and your time to come out here and show us how important this is. So we appreciate you so much.
Thank you. Thank you. Appreciate you as well.
Yeah, for sure. All right, y'all. Once again, this has been the Random Thoughts of Rain, and this was a special edition. So y'all stay tuned. Make sure you like the NPN Network, follow the NPN Network on Twitter, Instagram, Facebook, all that good stuff. Hashtag Random Thoughts of Rain, hashtag NPN Network. Peace. We out.
Have a good one.
You too.